Hey Vision, I'm Ashlynd.
And I'm Brigid Hermansen.
Did you know 300,000 children worldwide are diagnosed with cancer?
And this is why we are doing a mini documentary on childhood cancer awareness.
Every 3 minutes somewhere in the world, a family has to hear the words, their child has cancer.
15,780 children between the ages of 0 and 19 get diagnosed with cancer.
Over the past 40 years, the number of children diagnosed with cancer has increased by 35%.
1 in 285 children in the U.S. will be diagnosed with cancer before their 20th birthday. And today I'm going to be interviewing my sister.
Hi, I'm Hannah.
What day were you diagnosed and how did you feel when you heard the news?
I was a junior in high school, just starting my junior year, so it was September 18th, 2019, and I was diagnosed with non-Hodgkin's lymphoma.
And how did that make you feel when you heard the news?
I kind of felt like my life was over in a sense because I could not go to school, I was losing my hair, I couldn't do anything that a normal junior in high school would do. So I was really upset, but I felt like I didn't really have a choice, so I kind of just took it with grace and kept going.
How long were you in the hospital for?
I was in the hospital from September to February, so like 6 months.
How did cancer change your life?
It made me very appreciative of life itself and made me live life to the fullest, especially when I got to college. I kind of just got involved in everything, especially with Dawn. Being a childhood cancer survivor, it allowed me to use my firsthand experiences to help other children and families, especially teenagers, because I feel like teenagers kind of get overlooked in the world of childhood cancer because they're expected to kind of like take care of themselves because they are older, but is one of the leading causes of death in children, not only in the U.S. but around the world. And people don't really understand what it's like to go through childhood cancer.
While survival rates have improved, cancer will still shorten the life of the child. Only 4% of federal government cancer research budget goes to the pediatric cancer research.
I've seen a lot of children pass away that I have been close to, as well as severely traumatized, including myself. People don't really talk about the mental part of that. I still deal with PTSD, depression, anxiety from being in the hospital and being on different medications. I also still experience physical setbacks as well. I do have permanent nerve damage in my fingers and my toes, and I had to take steroids, which really screwed up my body. So things like that aren't really talked about.
What is your position at CHOP?
Yeah, so I'm a nurse practitioner at CHOP. I work in the Division of Oncology, so that's where we care for all of our children with cancer. And I split my role between two different teams. So I work on the solid tumor team, so that really mostly cares for patients who have malignancies that are considered solid, so on organs primarily, so a liver mass or a kidney mass or a bone mass or a muscle mass that would then need to come in and be treated by our oncology team. And then the other half of my role is in genetic predisposition. So I care for patients who have a syndrome or some sort of genetic history of cancer in their family that we then screen for different syndromes. And then if they do have a diagnosis that shows they are at risk for certain cancers, then we screen them over the course of their life so that we catch those cancers early. I was diagnosed with cancer myself when I was 22, when I decided that I wanted to pursue a career in oncology, like having that own perspective myself and knowing what that was like for them and how I could kind of use my experience to help them. And then I ultimately decided I wanted to be a bigger part of the conversation and making decisions about treatment. And so I decided to become a nurse practitioner so that I could still work with those same patients in that capacity, but have a little more of a role in making clinical decisions rather than like executing the decisions that are made.
Cancer do you see the most when children are diagnosed?
So as a whole in pediatric oncology, the most common cancer that we see is ALL. It's acute lymphoblastic leukemia, and probably 80 to 90% of the patients that are diagnosed with childhood cancer have ALL. And so it is what's most commonly seen in oncology clinics across the world, but definitely here at CHOP.
1 in 6 kids with cancer do not survive. About 50% of all pediatric cancer research is funded by philanthropies, supported by private donors, corporations, and foundations.
Cancer in children is actually considered a rare disease, and that number feels really big to us. But if you look at the population, it's actually really small in percentage. And so we see less children diagnosed with cancer, much less than we see in adulthood. It's really hard to say why kids get cancer. Some are inherited. Some of the cancers we see are inherited and that they're common in childhood. Some of the cancers I see of like the bones can sometimes happen in development because your bones are quickly growing as a child. And so when that goes off of the norm and it develops too quickly, it can cause cancers. A lot of speculation. So there's some we think might be induced by viruses that you might be exposed to as a child, and there are some that can happen with growth, or there are some that we think can be related to an exposure of something, but then there are others that we're just still trying to figure out why it happens.
Yeah.
Of the funding that is raised for cancer awareness, only 4% of it goes towards childhood cancer. And so, yes, there are less children with cancer than there are adults, but these children also have the rest of their lives to live, and not that that makes them more important than adults, but there's just so much life that they should be living outside of this hospital. And so just raising awareness about childhood cancer, about the need for more funding, about the need for better therapies for our patients so that more kids are cured will lead to longer lives for so many more children that aren't able to have that if they can't get the treatment they need.
I'm here with my mother, Amy Hermansen. How did you feel as a parent hearing your child had cancer?
Honestly, it was the worst moment of my life. I thought that moment that Hannah's life was going to be over as well. It's terrifying to hear those words.
What was it like being in the hospital when Hannah was going through chemo?
It was extremely difficult to watch your child suffer and go through so much, and you couldn't do anything about it. You couldn't change anything. You couldn't help them. You couldn't comfort them. It was very difficult.
How did Hannah being diagnosed with cancer change your perspective as a parent?
Well, first you think that it's never going to happen to you until it does. And you realize how important it is for funding and awareness of childhood cancer. So maybe we can one day find a cure to prevent children from suffering and dying and having long life consequences of going through the evil treatment of chemo.
Thank you for watching our mini documentary on childhood cancer awareness. It's very important to bring light and awareness to childhood cancer families and what they have to go through during that rough time.
I'm Ashlynd.
And I'm Brigid. See you later, H Vision.